Welcome. Hi, everyone, and thanks for joining today's educational session. So my name is Dr. Melanie Altas. I'm a gynecologist and sexual medicine physician at the BC Cancer Agency. I also work at the BC Centre for Vulvar Health here at Vancouver General Hospital. So in this presentation, we're going to talk about managing the impact of bladder cancer treatment on sexual function and intimacy. So this is part 2, where we're going to dive into more of a psychological approach. In part 1, we talked a little bit more about the medical or biological approach. So I'd invite you to explore part 1. But in today's talk, what we're going to talk about is we're going to dive a little bit more into sexuality and intimacy. We're going to go through sexual desire and arousal and what is the normal or common female sexual response cycle. We're going to talk about communication strategies, and we're also going to explore a little bit around body image. So here are some of the different educational modules that we offer, and they're offered either in person or through online programs. Most of these sessions are offered every month and are also offered within the clinic. So if you're interested in learning more about our one-on-one appointments or more educational sessions, please get in contact with the program coordinator. In the sexual health clinic, our goal is to provide education or knowledge, which is really powerful. We also want to provide supportive care and medical and surgical therapy in order to enhance sexual functioning, intimacy, and overall quality of life. So why should we talk about this? Well, sexual health is very important for overall quality of life. And many women feel unprepared for these changes as they go through their cancer journey. And knowing what to expect helps you make informed decisions. So in my clinic, there are really common questions that come up that we want to try to address over these 2 modules. So many women will ask, will I still be able to have sex? Will I still be able to feel sexual pleasure? Will I feel different about my body, and how will that look? And how can I talk about this with my partner? Well, sexual health is so important that the World Health Organization has put out a statement saying, sexual health is fundamental to the overall health and well-being of individuals, of couples, families, and community. And this sexual well-being depends on access to good quality information about sex, the ability to access sexual health care, and living in an environment that affirms and promotes sexual well-being. And we know that sexual health is important to cancer survivors. In 2010, the Livestrong Foundation did a survey where sexual dysfunction ranked as the 3rd most common concern for patients who have gone through cancer treatment. The 1st and 2nd were energy and memory, which also may resonate with you. So what happens when we don't address or prioritize sexual well-being? This can have a huge impact on people. We see an overall decreased quality of life. We see an increase in psychological distress. We see lower long-term adjustment to cancer and the consequences or any life change. We see an increase in depression, anxiety, poor psychological adjustment, and just in general an overall lower life meaning. We also see that people who experience sexual distress will have difficulty coping with other non-sexual side effects of the cancer or the treatment. So and I think we're in a shifting landscape where medicine is starting to understand and value sexual well-being. So because of this, and also because I've explained that sexual health is so important, you would think that we would be doing a really good job. But we're actually not. There are a lot of barriers to people addressing their sexual distress within a healthcare setting. And we can divide these into patient and provider or physician barriers. And what I mean by self-centered, this can be a barrier where patients or people may have difficulty putting their concern into words. So they don't know the language or they're not comfortable expressing their sexual distress. Patient-provider-centered barriers are things like a person or a patient being worried about bringing up their sexual health concerns. So they may think that they'd embarrass their physician, or that their physician will not know what to do, and will and that this will impact the physician-patient relationship. But on the physician side, we also have a lot of barriers, such as time constraints. So as you all know, we have very limited time to spend with people, and to try to address all of their concerns, including sexual health, can be very limited. We know that physicians have minimal knowledge and training, particularly around female sexual dysfunction, and this can be throughout medical school and residency. So there are many physicians who don't want to ask about sexual well-being because they don't know how to address it. They wouldn't know what to do. But I also see a lot of unconscious bias, or a lot of assumptions about a patient's sexuality. And this could be things like, if you have a patient who's older, maybe in 70s, 80s, or 90s, there are some physicians who may think that sexuality is not important to an older person, and that's not true. You may think if someone has advanced disease, so maybe metastatic cancers and palliative care, that sexuality is not important to them, and that's not true. So the treatment for bladder cancer often involves a surgery that impairs the vaginal length. So it may shorten the vagina, create scar tissue. It may change the sensation and lubrication, and thus global sexual functioning, intimacy with one's partner. So let's dive into a little bit more about understanding sexual well-being, intimacy, desire, and body image. So what is sexual well-being? So we actually don't have a great definition for this, but we have a framework that we can go through. So it involves these seven factors. So respect. And this may be things like feeling that your sexuality is valued by others. So this may be your physician, your other healthcare providers, or your partner. It can be around self-esteem. So feeling sexually attractive to others. So what makes you feel romantic, makes you feel sexy? Comfort. So this is a sense of peace or acceptance with who one is sexually. And something we call self-determination. So this is a feeling of control over the type of sex that one wants to have. So autonomy. Also a security, so feeling a sense of security about your future sexual experiences. Forgiveness comes into play, so feeling able to let go of negative thoughts and experiences. And resilience, so feeling able to adapt to new sexual situations. So as you're going through cancer treatment, or maybe your journey is after the cancer treatment, it can be important to think about these 7 parts of the framework and asking yourself these questions. So we touched on this a little bit in part 1. So when we think about sex, we commonly think about the action of sex. So we think of it as a behavior, something that we do. But sexuality is more a part of who we are. So how we experience and express ourselves as sexual beings across the lifespan. So it may include desire, pleasure, body image, emotions, your values, your identity, which includes sexual orientation, relationships, communication, and cultural or societal influences. So sexuality can be expressed with a partner or on your own, and it can change over time, especially during and after cancer treatment. So I hear a lot of myths in my clinic. People are really concerned about being sexually normal. And I can tell you that that myth of sexual normality does not exist. So what are some of the myths that we hear? So people with health challenges have no interest in sex. And I commonly see this where people who've gone through cancer treatment feel that they should just be happy their cancer is cured, they're in remission, and that anything else is a bonus, or that, so what, your sexuality was impacted, you survived cancer. And that's not true. Sex is for young people. That is not true. I definitely have had some 90-year-olds in my clinic. And good sex requires an orgasm, and that is not true at all. Sex education is always for disease prevention. And this is something that we see a lot in the healthcare setting, where a lot of physicians think of sexual health or sexual medicine as prevention of STIs, so prevention of chlamydia, gonorrhea, contraception, so preventing pregnancy, wearing condoms, using birth control. Sexuality encompasses way more than this. Sex should be spontaneous with no planning and no talking about it. And we're going to get into this a little bit more. And many times, sex actually does need to be planned. And that sex means sexual intercourse or penile vaginal insertion. And that's not true as well. And that men should initiate sexual activities. So we're going to address a lot of these myths as we go through this talk. An important concept to be mindful of is intimacy and how that relates to sexuality. So intimacy is that felt sense of closeness, of safety and connection with someone or with yourself. So intimacy doesn't necessarily involve sex. So a lot of people feel intimate with their parents. They may feel intimate with their children or a really close friend. It involves that emotional closeness, affection, being seen and understood. And a lot of other words that come up in this setting are things like trust, vulnerability, comfort. Usually involves companionship, teamwork, communication, and shared meaning or values. There can be a lot of overlap between sexuality and intimacy. For many people, sex is one way they express intimacy, and intimacy can strongly influence sexuality. So that feeling safe and close can often help desire and arousal, but they're not necessarily the same thing. Let's look a little bit more specifically at sexuality versus intimacy. So if you're in a partnered relationship, some of the sexuality goals may be what pleasure looks like now, what changes are medical, mechanical, or technical versus emotional, and what adaptations will help with this. Intimacy goals can be staying connected while you grieve changes, renegotiate roles, and rebuild confidence. If someone is not partnered, their sexuality goals may be reclaiming sexual identity post-treatment. What does solo sexuality look like, and how does this help to build confidence? Intimacy goals may be intimacy with self, such as self-compassion or body acceptance, and deciding what future relational intimacy will look like. So how and when to disclose cancer treatment and its impact, what are the boundaries you want to set, and how will you feel safe in future relationships? So what do I hear in my clinic? So I hear a lot of things around the impact of cancer and its treatment on sexual function. So for some people, going through cancer treatment will put them into menopause. And there are a lot of symptoms associated with menopause, such as hot flushes, sleep disruption, mood changes, joint pain. All of those things can impact sexuality. There may be a direct impact on vulvovaginal health, like shortening of the vagina, scarring, or adhesions, or the decrease in hormones that go along with menopause can cause dryness and a decrease in elasticity. There can be changes in desire, arousal, and genital sensations due to directly to the surgery, if there's an impact on nerve supply or blood supply, but also due to changes in hormones. There can be a change in relationship to self, such as an impact on body image and sexual identity. There can be a change in relationship to others. So it may impact your future, current relationship. There can be a shift in relationship goals, particularly if one person was a caregiver for the first time. There's also the impact on societal beliefs, and societal beliefs around how men and women should be in heterosexual relationships, specifically societal beliefs around what sexual desire looks like, as well as societal beliefs around what is normal sexuality. So in part 2, so in today's talk, we're going to provide psychoeducation. So education in itself can be really empowering. We're going to go through some communication strategies that you can engage in. We're going to help you refocus intimacy and sexuality with your partner. We're going to talk a little bit about sexual adaptation, mindfulness, and working ways that you can work on body image if that's impacted you. So when we talk about sexual function, it's really important that we take what we call a biopsychosocial approach. When I see people in my clinic, commonly people ask me, so is this medical or biological, or is it psychological? And it's not quite that easy. So it's not quite that black and white. There's a lot of overlap between all of these. So biology would be things like menopause, scarring, changes in blood flow, changes in hormones. Psychological contributors may be things like changes. So stress may change desire. We'll see anxiety. We'll see changes in sexual self-image, as well as the socio-cultural contributing factors, which I've touched on a little bit. What I find very helpful to do is to kind of anchor this talk in an understanding of the female sexual response cycle. So an understanding of what sexual desire, sex drive, libido, what that actually means, because it's not what we see in the movies or on TV. So when we see desire, libido, sex drive, or that sexual urgency in movies and TV shows, it appears like this. So it's like this burning urgency or craving for sexual intimacy. And this is not what we see in the healthy female population. So what's portrayed in movies is kind of an older model of sexual response where women will get that craving urgency, they engage in intimacy. As a result of that sex drive, they experience arousal, orgasm, and resolution. So it seems like it's quite simple. And that's not actually the case. So in the 1990s, early 2000s, sexual medicine physicians were looking at this traditional model. This is a Masters and Johnson model. And they realized that this didn't apply to the vast majority of the female population. So there was a physician in Vancouver, actually, her name's Rosemary Basson, and she came up with a new model of sexual response, which was more reflective of the healthy female population. And I'm going to go through this with you. And as I'm going through this response cycle, this may resonate with you. And I'd invite you to identify or remember or write down the parts of this cycle that really land for you. So instead of that experience of urgency or craving, we actually find that most women start from a place of being neutral. And by neutral, I don't mean apathetic or numb. I mean, maybe yes, maybe no, depending on a few things. So the first thing that we see depends on this maybe yes, maybe no, are the reasons that come up. So the reasons for engaging in intimacy. And I would describe these as positive or negative or approach or avoidant reasons. So some of the positive or approach reasons are things like wanting to be physically close with their partner, wanting to feel loved, wanting maybe a stress, wanting that emotional and physical connection. Those are what we call approach or positive reasons. Then what comes into play is the environment and the romantic stimuli. So does the environment feel safe? Are you worried your children will come in? But also, are the things that make you feel romantic and sexy, are they present in the environment? So things like, this is where we usually engage the senses. So sense of smell, sight, sound. Thinking and reflecting on those things that make you feel romantic. Then what happens, the brain looks at this information. So the brain looks at, are you starting from neutral? Are your reasons positive? Is the environment safe and sexy? And the brain decides if you're going to experience arousal. And by arousal, I mean the genital and physical arousal. And then what we see is desire. So this is actually where desire or sex drive comes into play. So it's that desire to continue being intimate in the moment. And we call this responsive desire rather than a spontaneous desire. So the desire is not driving the sexual encounter. Then, is the outcome pleasurable? So is it painful? Do you experience arousal? Maybe do you experience orgasm? Are your reasons met? Then this will this will lead you to the next situation or the next time to being neutral. So our goal with sex therapy is to get back to this place of neutrality. So that spontaneous desire that I mentioned on the earlier slide, that's not something that we see very often. When I go through this with people, this really resonates with a lot of women. But one question I get, people will say, but when we were in university at the beginning of our relationship, I felt this spontaneous desire all the time. And I would challenge that a little bit. If you remember when you were dating your partner at the beginning, you weren't living together. Let's say you spoke on a Monday, and on Monday you decided you were going to have dinner on Friday night. So on Monday when you talk, that's actually where the encounter is beginning. So you're starting from neutral then. All week you're thinking about those reasons for being with this person on Friday night. You're thinking about, what you're going to look like, what you're going to wear, getting your hair done, nails, all of that stuff. So by the time you show up to dinner on Friday night, you're actually coming in to that encounter at this later stage where you're experiencing arousal. So I feel like that's why a lot of people will say when they were younger or at the beginning of the relationship, they felt more of a spontaneous drive. And then that shifted when people moved in together. So let's say we interrupt a part of this cycle. So let's say the outcome is not pleasurable. Maybe the outcome is painful. Maybe you're in menopause and the tissue in the vulva and vagina has become thin. It's not elastic. It causes that friction rubbing sensation. Maybe you have scarring from the surgery or shortening of the vagina. And physically, that sexual encounter is not pleasurable. What we find happens is that this then leads you to not be neutral the next time. And you start to develop this pathway where you're more aversint or avoidant. And this is what we call the sexual avoidance cycle. When you're starting the encounter from a little bit or maybe a lot of aversion or avoidance, what then happens, your reasons shift to more of the negative or the avoidant reasons. And this may be things more like where we see more duty, obligation, fear of losing a partner. You may feel shame over what you feel a partner should be within a relationship. So we start to see more of these avoidant or negative reasons. And then what happens, people will skip those romantic stimuli. So they'll skip those things that make the encounter sexy or romantic. They may even skip that arousal. So they just want to get it over with. And if a woman does not experience arousal, they will not experience responsive desire. Those two are very intimately linked. And then what we start to see is that the sexual aversion or sexual avoidance is really enhanced. So you may have seen this little section down in the corner where we talked about brain processing. So what does that mean? Well, this is where the brain comes into how you experience sexuality. So, and for women, there are a lot of things that impact the mind, the brain, and therefore their sexual health. So things like stress, anxiety, depression, fatigue is a really big one. So if someone is fatigued, their sexual desire will be low. Those two are very intimately linked. Things like pain or other medical conditions. But if you look at the very bottom, distractions and judgments, these are things that I see very common in women who are experiencing changes in sexuality. Let's talk a little bit about what these mean. So distractions are things like, let's say in the moment that you're, rather than being present, you may see in the corner the laundry that needs to go away. You may think about that email or those things that you need to do before you go to work in the morning. All of these things take away from you being present, being in the moment. I also see a lot of judgments come up. So these are more kind of negative distractions. So these may be things like, I'll see this with people who experience maybe a weight gain as they get older or as they go through cancer treatment, depending on the medications that they're on. If someone has a stoma, if someone has changes maybe in their body, such as a large scar, that can actually be a judgment that someone has about how they look and how they're performing sexually. So where do I start and what do I do for low desire? So I think what's really important is that you really connect with this framework that I've just gone through and really understand the difference between spontaneous desire, that's what we classically think about when we think about sex drive, is that craving and urgency, and to really think a little bit more about responsive desire and accept that as being a normal, common, healthy approach. We really emphasize communication with your partner, and I'm going to go through some strategies on the next slide. Communication about sexual health becomes really important, particularly when people have been together for a long period of time and when they start to go through little bumps in their life. So this would be a cancer diagnosis, cancer treatment. We'll see this around when someone has a child. We'll see this around couples who maybe are having a difficult child. So a child who has a medical issue, maybe has behavioral concerns, or around when your parents start to become sick and you become a caregiver for your parents. We'll also see this around stresses, a big move, or if someone loses a job. This is where communication becomes really important. And we know there's been a lot of research on couples who've been together forever, so decades of being together in their 60s, 70s, and 80s, and couples who report being sexually healthy. Researchers are really interested in what is that magic bullet, what's that magic ingredient, and what comes out consistently is those couples are ones who talk about and prioritize their sexual health and how they want that to look. So we know for the most part, people and couples who leave things to being natural or spontaneous, it may not work out well long term. A really good starting point can be with reviewing your reasons for intimacy. So if you remember on that cycle, I talked about the positive and negative, or the approach and avoidant. For a lot of people going through these kind of life shifts, like a cancer diagnosis, they'll start to experience that duty, obligation, fear, and shame. And if you imagine, I usually talk about this with people. If you think those reasons or those motivations over and over again, it'll kind of create a groove in your brain. And if you imagine, let's say, a big field that is full of grass, and if there's a single pathway through this field, if you imagine that as being your negative thoughts, so every time you're taking this pathway and it just kind of creates this groove through the field, to shift and create a new pathway requires work. It's not as comfortable. But it's something that I encourage people to do to kind of create that new groove, or create that new automatic pathway instead of taking the path that you always travel. And this does just require a little bit of work. So thinking back to what are your reasons for being intimate with your partner, that emotional closeness, that physical connection, and practice thinking those positive or those approach thoughts, so that you can move away from those avoidant thoughts becoming automatic or habitual. So let's touch a little bit on communication and intimacy. This is one of the most important ways to improve connection and sexual functioning. By encouraging or maintaining or practicing that open dialogue, you can ensure that each of you are satisfied with your sexual relationship together and you're on the same page. And I've already touched on that this is one of the most predictive factors of sexual satisfaction post-treatment, of people who talk about sexual well-being. And it may be, if you remember at the beginning of the modules, we talked about the difference between sexuality and intimacy. This also includes intimacy. So what are ways that you can be close emotionally and physically with a partner through this journey? What I encourage people to do is to, as I've already touched on, is planning to have these conversations. So not just planning intimacy or sexual activity, but planning the conversations about those things. So if you spring conversations like this on someone unexpectedly, they usually won't go well. So what I encourage my patients to do is to set a time. So let's say Sunday night at 6 p.m. we're going to talk for 15 minutes about how we want intimacy to look during the week, or we're going to talk about things that make us feel romantic and sexy, or we're going to talk about our reasons for being intimate, or maybe we're just going to talk about this sexual response cycle that I just went over. That way, so it's kind of setting up a meeting with an agenda so that both partners can come into that meeting well prepared. And it's also at a time where it's unemotional. So these things can help you deal with any of the changes that occur. It can enhance those feelings of closeness and confidence together. And it also takes away that trying to guess how your partner is feeling about things. I think when people are going through a stress in their life like this, there can be a lot of assumptions about what the other person is feeling or thinking. And these assumptions are many times or often can be wrong. So how do you communicate better? So this is where it does require work and intentional reflection. So some things that you can do is think about what is important to you and your partner. Think about what you want from your sexual and intimate life and relationship. Discuss how both of your thoughts and how you can make changes. Be clear, honest, and open about likes and dislikes, and recognizing that those likes and dislikes may change over time. Pay attention to partners' responses and acknowledge their feelings. So make sure it's a time where both people have time to express themselves and the other person listens. You can write, if you have trouble with this, you can write down your thoughts and ideas in letters to each other. And also, if you find this really difficult or you've attempted it and it's been challenging, you can see a relationship counselor or a sex therapist together. And I do tell my patients that when you experience these challenges in your life, it may be the first time that sexuality and intimacy is not going well for you. And so these conversations can be awkward in the beginning. They can be very challenging because we're not taught to have these conversations. And these are conversations that are definitely not mentored to us. So we don't see other people having these conversations. And this is definitely not what we see in TV and the movies. So I would expect these conversations to be difficult and awkward in the beginning, but practice does help. We've already touched on this a bit, but I always like to re-emphasize that intimacy is more important than sex. So touch, affection, feeling emotionally and physically connected. That open communication is key. And also staying optimistic and hopeful that many women find sexual pleasure again. It just may look or feel a little bit different. So we've talked a lot about partnered relationships. So what are some things that you can do if you're single and considering dating, or maybe not considering dating? So being sexually active and feeling attractive is just as important if you are single. So the same treatments and resources are available for single women, whether you want to be able to engage in solo sexual activity or starting a new relationship. All of this information applies, and we highly encourage single women to seek out sexual health support. If you're starting out a new relationship, we know it can be challenging to share your cancer experience, and we find that being honest and thoughtful and keeping it simple is important. So let's go through the female sexual response cycle in a little bit more detail. So let's pull out those parts of the sexual response cycle and how we can deal with it. Let's start a little bit. Let's say if the outcome is not pleasurable. So we've already touched on this a bit. If you're experiencing painful sex, I would encourage you to go back and revisit part 1. And in part 1, we talk about using lubricants and moisturizers. We talk about pelvic floor physiotherapy and exercises you can engage in and some rehabilitation devices you can use. We also talked a little bit about vaginal reconstruction. So revisit part 1 if you're experiencing painful sex. So let's go on and talk a bit about those distractions. So this is where mindfulness exercises can come into play. So this is a skill that can be learned with regular exercise and practice. Mindfulness means the awareness of thoughts, behaviors, emotional and physical senses. So it's basically encouraging you to be present in the moment. And particularly for women, this is a really important part of sexual activity and intimacy. There has been a lot in the popular press and media on mindfulness, touting it as this cure-all. And for some people it actually is. So the science actually supports this practice as it relates to sexual health. There's a huge amount of research and studies on sexuality and mindfulness. And we know that sexual desire is closely related to those internal thoughts, which include habitual and automatic psychological patterns, like those negative, those avoidant reasons that I talked about. But this also includes anxiety, maybe associated with negative or disappointing past experiences, sexual inhibitions, negative emotions, low self-esteem, and stress. So practicing mindfulness in many studies has shown to lead to significant improvements in sexual distress, sexual function, and mood. So this is the paying attention to the present moment with intention and purpose, and also without judgment. So it's paying attention to what is happening during intimacy. It's about being present and accepting the moment as is. I make it sound really easy. It's not. This is actually this takes a lot of work, and it would be really hard for you to just do this on your own. So what I encourage people to do, and a good place to start, is to start outside of sexuality. So you can practice mindfulness in your non-sexual life. If you've ever taken a mindfulness-based stress reduction course, the raisin may be familiar to you. So usually what happens, all the participants are given a raisin, and they have to be present with this raisin for a few minutes. So kind of feeling like, what does it feel like? What's the texture? How does it change shape? And then eating the raisin. How does it feel in my mouth? What does it taste like? What does it smell like? So it's avoiding those distractions, practice breathing, engaging all your senses, and not worrying or as the mind wanders. So it's practicing that when your mind does wander and bring up random thoughts, to not to criticize, to just notice and gently bring your attention back to the present moment. So you can practice this with mindful eating, doing mindful exercises. Let's say if you're doing stuff around the house or you're in the gym exercising, working on that being present, and then eventually bringing it into sexuality and intimacy. So it's a way to release expectations about being perfect and having to perform. It's a way to practice self-compassion, to let go of the self-criticism, the negative body image concerns, and sexual shame. So if those thoughts do arise, to not argue with them, to notice them, and just let them go. There's a wonderful book by a psychologist who practices and does research in Vancouver. Her name is Dr. Lori Brotto. She wrote a book called Better Sex Through Mindfulness: How Women Can Cultivate Desire. This is a very readable book. She's also just put out a workbook. So exercises and strategies that you can do specifically and write down your thoughts and journal around those. She has mindfulness recordings on her website, and I've also listed some Instagram accounts that talk about mindfulness. Again, revisiting the brain processing section of the sexual response cycle and looking specifically at the judgments. So in relationship to cancer, this is where I see things around scarring, particularly in the abdomen, or I see this a lot in breast cancer patients as well. People who have a stoma secondary to the cancer treatment, or people who are in menopause, and sometimes people gain weight in menopause, or with certain cancer treatments, people may also notice weight. For many people, those things don't bother them. But definitely it's something I see in my practice where those things do bother people, and a lot of judgments and self-criticism comes up. What we see in sexual dysfunction a lot, or what we call in sex therapy, something called spectatoring. And this is where during the intimacy or sexual activity, one of the participants will imagine themselves as though they're up in a corner of the room and picturing them watching themselves and how they must look. And this comes up for men as well. And that can lead to a lot of self-criticism, judgment, and shame. So let's touch a little bit on what is body image. So this is how you see yourself when you look in the mirror, or it's how you picture yourself in your mind, or it's how you picture yourself during sexual intimacy if you do that spectatoring. It's what you believe about your appearance. It's how you feel about your body and how you sense and control your body as you move. And so this may include kind of where you are presently, but it also includes a lot of things around memory, societal context, assumptions, and generalizations. These are three things that influence body image: identity, investment, and stereotypes. With identity, these are some of the beliefs that may come from their upbringing and may be reinforced by society, including social networks, social media, and also their peers. Some of these beliefs may be fostered by experiences, accomplishments, or lifestyle. And these ideas about self and how strongly they are held will affect how women cope and adjust to a cancer diagnosis, such as surgical changes, menopause, and other things. The investment in physical appearance and health. So an example of this would be how much emphasis someone puts on their physical appearance, or how much it plays a role in determining your happiness, your personal satisfaction, and well-being. So let's say someone who in the past was really meticulous about exercise and healthy eating, they may feel betrayed by a cancer diagnosis. They may feel devastated by it. And after treatment, they may be unable to return to pre-treatment body shape or the level of physical stamina. And this can affect how someone moves forward after cancer treatment. And lastly, we have stereotypes of femininity and attractiveness. And this is where cultural and societal influences come into play, where these shape how women think about and view themselves. And this strongly affects how they feel about their bodies. And these can kind of create a standard of what's considered beautiful or ideal for someone. And this last one, I'll see this sometimes where people will talk about how a friend or a partner will only comment favorably on your appearance when you apply makeup or you have yourself styled professionally. These can really impact your body image. So women who identify with traditional notions of femininity or attractiveness sometimes feel a sense of shame when they cannot return to a level of physical appearance that they had before the cancer experience. What may you experience? So some of the things that people will talk about is that inspection or constantly monitoring their body. They may compare themselves to past self or to media ideals. Or instead of constantly inspecting, they may do the opposite, where they completely avoid looking at themselves in the mirror. They may be really critical about not being able to return to previous activities and feeling where you're not as you should be. So how to move forward? This is where time is really important. There's a lot of pressure on people when they immediately finish cancer treatment. So they recover from their surgery, they finish chemotherapy and radiation, and they feel that they should be back to normal right away. And that feeling back to a baseline or to a newer baseline is something that can take time. I think it's really important to reflect and identify those internalized messages. So these are those harmful messages from the media, our culture, our friends and family about the female body. Reflect on which of these messages are now influencing you. How do you feel about them as you reflect? Do you think they're placing pressure on you to conform in a specific way of looking or a specific way of being as a person? And you might start by questioning that there is a right body type, or that a woman's body needs to be constantly fixed or altered or take up less space. It can be helpful to rebuild your sense of self by getting to know yourself now and redefining who you are, especially as you may have discovered new things about yourself. Think about or write about how the cancer experience and what that has brought to you. What did you learn about yourself? What do you find yourself wanting or valuing now? And has that shifted from who you were before? And really finding new ways to engage with your body. So this is all a process of sexual optimization, is what we call it. So this is having an awareness with the potential for sexual difficulties following any disruption in health. So when you start down this pathway of sexual well-being or learning more about yourself as a sexual person within or not within a relationship, you can gain knowledge about sexuality and how to cope with these difficulties. Learning how to communicate with a partner or relearning how to communicate with your partner. How to manage feelings of sexual inadequacy and femininity, and understanding how societal myths may affect sexuality and intimacy, and adjusting those values and beliefs, and also discovering new ways of supporting your sexual health and goals. So some books that I really like to recommend to people, particularly if you find that you are self-critical and judgmental, is Learning Self-Compassion. And I find women in particular are very, very hard on themselves. So these books incorporate mindfulness and also incorporate self-compassion. They're both really wonderful books. Good starting points to just learn about women's sexual health are these two books by Dr. Jennifer Gunter, is a gynecologist. She wrote a wonderful book called The Vagina Bible. And Emily Nagoski is a PhD sexual health educator, and she wrote a book called Come As You Are. These are the two books that I recommend to people. Both of these clinicians do a lot of TED Talks and podcasts. So if you don't like reading, you can also find them online by Googling their names. Some other resources that you're likely connected with are the bladder cancer support groups. Connect with the sexual health clinic and engage with their counselors. Inspire Health is a wonderful organization. If you haven't connected with them, I would encourage you to do so. It's a BC-based group that provides free complimentary services to any person who has gone through cancer treatment. So they have counselors, they have nutritionists, they have exercise physiologists. Allenish Society is also a cancer-based organization, pelvic health physiotherapists, and also educational websites that are listed there. So just in summary, how do you begin? And I think it's important to remember that nothing is a quick fix. So this is going to take time and practice. You can begin by talking to your partner, can help you deal with changes, and also recognizing that maybe in the beginning those conversations will be a bit awkward. Discuss ways of enhancing intimacy without vaginal insertion, and there are many ways. Communicate with your partner about what you'd like to see within your intimate relationship and what feels good for both of you. You can request an appointment with our sexual health clinic and one of the counselors. And our hope is that this information is helpful and empowers you as you journey through the sexual adaptation process. And I'm just going to end here with the contact details for the BCSC program, including program coordinators who you can reach out with to access those previously mentioned services. And thank you for joining us today.